So the innermost is dentin. So the crown is covered by cement. The root of the dentin is covered by cementum. And then the central soft portion is called the pulp. And then the gingiva, what is the epithelium lining the gingiva? Stratified squamous. So those are the things that you need to remember about this histology of the tooth.
Yes, Doc.
When you study this slide, begin with the low power magnification. Begin with the low power magnification. So the rest of the hematopoietic cells will have that characteristic size. Then you will be able to see the largest cell, the bone marrow. Okay, is called the megakaryocyte. Mega is huge, large. So kaya si Sharon mega star. Now, we will be able to study only two populations of blood-forming cells. That is also another megakaryocyte, low power magnification view. So we will be able to study only two populations of blood cell forming cells in the bone marrow. The myeloid and what is the other population of cells that can be studied?
Lymphoid.
What?
Lymphoid.
No, the lymphoid cells are usually seldomly seen.
Platelet.
Erythrocytes. Erythroblasts.
Lymphoid and
Platelet.
the myeloid and the erythroid cells.
Erythroids.
Myeloid and the erythroid cells. Between the myeloid and the erythroid cells, more numerous will be the myeloid cells. So the first identifiable cell in the myeloid series is myeloblast. Okay? That is the actual appearance of a myeloblast. Now, how do you describe a myeloblast? So look at the other cells in that field. How will you describe the size of the nucleus of a myeloblast as compared to the size of the other cells in the field? Okay, larger. It has a larger nucleus than the other cells, and then it also has a very small volume of cytoplasm. Okay? Remember, what group of cells is produced by the myeloid series? What are the mature cells produced in the myeloid series? Neutrophils, eosinophils, and basophils. Their cytoplasm contains granules. Okay? That is why they are collectively called granulocytes. Now, look at the cytoplasm of the myeloblast. Are you able to see any granule? No. So that is the identifying feature for the myeloblast. As a large nucleus with scant cytoplasm without granules. Okay, next cell following the myeloblast is the promyelocyte. Okay, very good. How do you identify a promyelocyte?
Start from granules.
Okay, that is a promyelocyte. Notice that the volume of cytoplasm is already larger than the cytoplasm of a myeloblast. And it will still have a round to oval nucleus. However, there are already, unfortunately, the stain on this slide is already very faint. There are violet colored granules in the cytoplasm of a promyelocyte. So those granules are called azurophilic granules. Very good. Azurophilic granules. Now, so that is the identifying feature for a promyelocyte. Round to oval nucleus with azurophilic granules in its cytoplasm. Following, the promyelocyte is
Myelocyte.
myelocyte. That's the stage where you will be able to identify already the precursor of
Basophil or
the neutrophil, the basophils, and the eosinophils. Because the azurophilic granules will now be accompanied by the specific granules. So again, azurophilic granules are colored blue. And then specific granules are most of the time colored pink. That's a close-up appearance of pixelized of a myelocyte. It should contain in its cytoplasm two types of granules: pink-colored granules, which are specific, and violet-colored granules, which are the azurophilic granules. Again, the nucleus is round to oval. Following the myelocytic stage is the metamyelocyte. Okay? Again, a metamyelocyte contains both azurophilic and specific granules. The difference will come in the indentation of the nucleus. So if whenever you see a cell with both azurophilic and eosinophilic granules with indented nucleus, it should be the metamyelocyte. How about that cell? With two types of granules.
Myelocyte.
Okay?
Myelocyte.
Myelocyte.
Takes the myelocyte. Metamyelocyte.
So how about that cell? How should you call that cell?
Metamyelocyte.
Okay, a metamyelocyte. Following, the metamyelocyte is the bond cell. So before the nucleus becomes fully segmented,
Ay, yung indentation.
so it will have that characteristic shape first. The bond, what is the other name for the bond cell? What is the other name?
Segment.
Stop.
Immature.
That is a stem cell. That is
Stem
a
cell.
stem cell. If the nucleus becomes fully segmented already, the cell will be called
Mature cell.
Mature.
segmented. Okay,
Segmented.
just like that neutrophil, segmented. That stage should be called
Metamyelocyte. Metamyelocyte.
metamyelocytic stage. identify the cells in the myeloid series, you will need to look at the granules in the cytoplasm and the shape of the nucleus. Now, for the erythroid series.
Feel ko maubos din siya. 3 minutes.
Cell in the erythroid series. The proerythroblast, which is also called by what name? Pronormoblast. Pronormoblast. Proerythroblast. Okay, that cell contains two types of granules in its cytoplasm with characteristic shape of the nucleus. How should you call that cell? That cell contains two colors of granules in its cytoplasm with the characteristic shape of the nucleus. Okay, and mesamyelocyte.
Ay, di ba? Sabihin ko lang.
Okay, for the erythroid series. Okay, that is how a pronormoblast or proerythroblast will look like. Okay, just like the myeloblast, it will have very large nucleus with very scant cytoplasm. And then look at now the nucleus of the cell pointed. Yung chromatin niya is indeed uniform. You will be able to see holes in the nucleus. That is how you should be able to identify the erythroid cells. All cells in the erythroid cells, when they possess nucleus, their nuclei will have holes. So that is the identifying feature of the nucleus of the erythroid cells. So just like that cell, an erythroid cell in the erythroid series, mayroon ding holes sa loob ng kanyang nucleus. Okay? So we will identify that cell later. However, that's the appearance of a proerythroblast or a pronormoblast. Following the proerythroblast or the pronormoblast is the basophilic erythroblast. That cell pointed. Again, the characteristic holes in the nucleus. And then notice the cytoplasm now. Unfortunately, the stain of this slide is very faint already. The cytoplasm is actually colored violet. In comparison with the cytoplasm of the red blood cells, which is colored pink. that cytoplasm is much darker in color because it is actually colored violet. Now, why is it colored violet? Yes, ito tinawag na basophilic normoblasts. What protein is present in the mature red blood cells? What imparts the color of the cytoplasm? Hemoglobin. Okay? At this stage of development of the red blood cells, there is no hemoglobin synthesis yet. Okay? However, the organelles and the command needed for hemoglobin synthesis is already present in the cytoplasm. Hemoglobin, being a complex protein, is produced by one organelle. Particularly, being a complex protein, hemoglobin should be produced in rough endoplasmic reticulum. So the basophilia in the cytoplasm is because of the presence of the rough endoplasmic reticulum plus what will command the rough endoplasmic reticulum to produce hemoglobin. The command coming from the nucleus. How does the nucleus communicate with the rough endoplasmic reticulum to produce protein?
Ribosomes.
Very good. mRNA. So the characteristic color of the cytoplasm is imparted by the rough endoplasmic reticulum plus the mRNA, violet colored cytoplasm. Now, when the rough ERs have already received the mRNA, they will now begin to synthesize hemoglobin. So the next stage in the series is characterized by a cell having a combination in the presence of two colors in its cytoplasm already. Violet, mRNA, and rough endoplasmic reticulum plus pink color in the cytoplasm already, indicating that there is already the start of hemoglobin synthesis. And because that cell is displaying two colors in its cytoplasm, it is called polychromatophilic normoblast. So poly refers to many, and then chroma or chromo to color. So poly or two colors are displayed in the cytoplasm of the cell already. So the series will begin with a pronormoblast followed by basophilic normoblast. And then when there is already a start of hemoglobin synthesis, polychromatophilic normoblast or polychromatophilic erythroblast. Again, how do you call the cell point? Pro-erythroblast or pro-normoblast. Okay. Those are better appearances of a of the polychromatophilic erythroblast. Okay? Notice that you will be able to identify pink and then blue to violet colors in the cytoplasm. Notice also the size of the two cells pointed. Familiarize their size and then shift your attention now. Okay? So polychromatophilic normoblast, and then the next cell in the series is the cell pointed. Orthochromatophilic. Notice the difference in the size.
Smaller.
How do you call that decrease in size? The shrinking of the nucleus? Pyknosis. Now, before concentrating on the nucleus, look at the color of the cytoplasm of the mature red blood cells. Especially the portions of the cytoplasm containing the protein hemoglobin. Compare the color of hemoglobin in the mature red blood cells with the hemoglobin in the orthochromatophilic erythroblast. So again, chroma or chromo refers to color. Ortho refers to right or correct color, indicating that there is now near completion of hemoglobin synthesis. So that the color of the cytoplasm now resembles color of the cytoplasm of the mature red blood cells. Okay? There is now significant decrease in the number of mRNA in the rough endoplasmic reticulum. Thus, the cell is called a chromatophylic normoblast. Normoblast with the right color of the cytoplasm already. Okay? So before the red blood cell, a red blood cell becomes mature, it will have that appearance first. You will not be able to see yet the central area of ano. That cell is called
Reticulocyte. Reticulocyte.
Who among you here are medtechs?
Yotam.
Okay? Will you be able to call the cell pointed as reticulocyte? Why?
White stain.
So a reticulocyte can only be identified by using vital stain. So this is that vital staining. However, that cell, if stained with vital stain, should be called a reticulocyte. So in this staining, it is called polychromatophilic red blood cell. Polychromatophilic red blood cell. So it is very easy to identify a polychromatophilic red blood cell because of the absence of central area of halo. Then the nucleus is already outside of the cell. So identify that cell pointed. First of all, you need to classify if it is myeloid or erythroid cell. Myeloid or erythroid?
Erythroid.
Myeloid. Why?
Why?
Granules.
Granules.
Ah, okay.
So one type of granule or two types?
Two.
Two types. And then look at the shape of the nucleus. Is it already indented or not? Not. So that cell is
Myelocyte.
myelocyte. How about that cell?
Hindi. Polychromatophilic.
Myeloid or erythroid?
Erythroid.
Erythroid. Look at the color of the cytoplasm. Polychromatophilic.
Pag-ortho mo darkness.
How about that cell?
Myeloid.
Myeloid. Particularly what stage?
Myelocyte.
Myelocyte. How about that cell?
Myeloid.
Oh, Berta de John.
How about that cell?
Segmented.
Band.
Ay.
And how about that cell? Polychromatophilic.
Kung malaki, for erythroblast.
Yan silang dalawa.
Polychromatophilic.
Yan silang dalawa.
Polychromatophilic.
Polychromatophilic.
Pag walay granules.
Band cell.
Those two cells.
Baso.
Orthosomatophilic. Okay. So sa basophilic, very violet ang color ng cytoplasm.
Ortho daw.
How about that cell?
Band
Band.
cell.
So do you have any question? Again, be responsible in studying the histology of the group. So see you